Hi parents! Today we're going to talk about building in a good sleep routine for your kids, specifically young kids, your toddlers and your preschoolers and your young children. So let's get started. I'm Leslie Blevins. I am a psychologist at Enilda Clinic at enildaclinic.com. I make learning videos about twice a week, and you can sign up for those learning videos by going to my website and getting on the email list. All right, so let's start with a sleep routine. It's important to have a sleep routine because sleep is a behavior just like any other type of behavior. So right now I am sitting cross-legged on my couch, and I'm betting that you're sitting a different way. You could be sitting with your feet flat on the floor, your legs crossed, you might not even be sitting at all. But we all sit in a different way, and that is a behavior. If we did that sitting behavior across the next 10, 20, 30 years of our life, we would all have different health outcomes based on that sitting behavior. We might have different aches and pains in our backs, or we might, if I crossed my legs for the rest of my life and sat this way, I might have numbness in my feet. And so it is a behavior, even though it doesn't seem like we're doing something. Sleep is exactly the same thing. We're training our brain to engage in the behavior of sleep by giving it certain cues day after day after day. And those cues can even happen in the middle of the night, they can happen right before bed, and they help us to, over time, form a pattern for how we engage in sleep, whether it's a fitful sleep, a restful sleep, whether we wake up in the morning and we feel calm and relaxed, whatever it might be. That's why oftentimes whenever we are having difficulty with sleep, if we were to ask our doctor about it, they might recommend a brief bout of therapy just to kind of help you work on maybe sleep hygiene, or maybe even the thoughts and patterns that you have with your sleep and the way that you feel about your sleep. Okay, so this is all about young kids and what's happening for them. And because you are the all-powerful, knowing parents, you get to have the awesome job of setting up your kid for having some awesome sleep. So let's talk about what you can do. The best thing, or the most awesome thing, is that you kind of get to set up your kid for having a relaxing sleep routine. And that'll be important because you want them to be able to go to bed and have a nice little insert into falling asleep relatively easily, rather than being awake for an hour or two after they are after you're putting them to bed. The next big thing with having a sleep routine is that it's going to help build a positive attachment with the parent. And so it's a nice routine that you guys can have throughout your day that gives you just some one-on-one time, or even just the child with both parents, or the siblings and the parents together, where you get to just have some positivity in your day, where there's very little commands and very little responsibilities going on. And so this is an awesome time to kind of build it however you want it to be. Okay. So the next piece, let's talk about what your sleep routine might look like. The ideal sleep routine for a young kid is going to be about 30 minutes, and it's going to include a few key pieces. The first piece is going to be a hygiene piece. So this would include definitely brushing the teeth, and then you might also include things like washing the face, okay? The second piece is going to be changing into pajamas. And this is actually really key. This is something that I mention to a lot of my clients whenever we're working on sleep hygiene, because changing into pajamas is a really clear indicator that we can use to help our brain to understand that it's time to go to sleep. And so I want you to think about if your kid has specific pajamas that they use to go to sleep in, and they can have 2 or 3 pairs, but you want it to be specific pajamas that are very distinct from their play clothes or the clothes they've been wearing around all day. Definitely different from clothes they might be at school in. The kinds of clothes where they're active and they're all kinds of worked up. And so what you really want is to have clothes that over time their brain associates with feeling calm, relaxed, and wanting to just kind of pass out and go to sleep. Okay, so the benefit is a long-term benefit there to using pajamas. And then the third piece to a routine is that engagement piece between the child and the parent. And so ideally, it's going to be something like reading, or maybe looking at pictures, just some sort of one-on-one interaction that's really positive. I do have some other videos on enildaclinic.com about praise and about reading. Now, not necessarily instructional reading. This would be a time for you to just read a story to your child and just to let them practice their active listening skills. And so an opportunity really for them just to have that positive experience and joyful experience of interacting with you. Very few commands though. This wouldn't be a time to actually teach them how to read. And so throughout that whole routine, again, you want it to last for about 30 minutes. This gives their brain enough time to really start to initiate and to have that cascade of different body chemicals that tells them that they're getting sleepy, to kind of get into the zone of feeling sleepy and to get ready to fall asleep. Anything shorter than that, and they're still going to be pretty hyped up from the day, and they're probably going to give you some difficulties with readily getting in bed and falling asleep. Anything longer than that, and what you're probably seeing is a delay to going to bed and maybe a sense of wanting to maintain that attachment with you as the parent. And so this brings me to my next point. You really want to have consistency in the routine that you're doing. And so, for instance, with the hygiene, you want to have that first every single time. Putting on the PJs, you want to have that second every single time. And then doing your interaction routine, you want to have that third every single time. Whenever you do the routine in the same order every single time, it teaches the child over several days or weeks or months how to relax in a consistent way. They understand what to expect, and then they'll eventually stop asking you to extend the duration of the time together. And so, for instance, if you guys are going to read a book together, you might establish a rule of only one book or only 2 books, whatever you want your rule to be, and then you want to be consistent with that. Now, if this is very different from what you guys are doing right now, yeah, they're probably going to give you a bit of pushback in the beginning, but the consistency is the key. And so as you are being consistent, and then over several days, they'll start to use that consistency to help them to learn how to relax into the routine and how to accept bedtime more easily, and then how to fall asleep more easily as well at the end of the 30 minutes. Okay. And then, so this video is really just about the 30 minutes before bedtime, the things that hopefully maybe you hadn't thought about before. I know, there's lots of advice out there about turning off the TV and electronics a couple of hours before bed, and absolutely, those things are fantastic. But I'm betting you've heard about those things before. I am going to throw in a couple of bonus things for you right now, and that is going to be to think about the bedtime routine as actually occurring within a 24-hour time period. And so one of the best ways to have a consistent falling asleep behavior is to have a consistent wake up behavior. And so especially this actually might start to go into older kids a little bit, but if your kid gets up pretty early for school on the weekdays and then they sleep in really, really late on the weekends, that's going to create a lot more difficulty to get them to go to bed consistently across the weekdays for you. And I know a lot of times families just want to have fun and they want to have some relaxation on the weekends, but try to keep it within maybe about a 30-minute window for bedtime, so that whenever they're waking up, you're also keeping it within about a 30-minute window for them to wake up. The key there is the wake up piece, because if you're waking up consistently at the same time, then you're going to want to fall asleep consistently at the same time too. So it makes bedtime easier. The next part, my next bonus, is exercise. So whenever we're exercising every day, it's helping to regulate the different hormones we have in our body, and it helps us to relax and to fall asleep easier at night. So if your kid is particularly having difficulty with going to sleep at night, you might try giving them some physical activity earlier in the day. Definitely you want to have about 3 hours before they go to bed between that exercise and bedtime. And so that might mean for us that that's right after school. You want to either have them in some sort of extracurricular or sport activity, or maybe you just spend some time going to the park or playing in the backyard or in the neighborhood, something like that. Something to really get their body moving, get their blood pumping. The idea is to have about 30 minutes of moderate activity, which means that you can talk, but you can't sing. And then doing that every day will help their hormones to really regulate really well so that they can fall asleep easier at night. If you have concerns about whether your child is sleeping enough, I recommend that you look at the National Sleep Foundation's website. They have recommendations across different age ranges. So if you're not sure, just take a look there and you can get a better idea for where your child is faring based on their age. And then of course, always talk to your child's pediatrician and get advice from them. And if you're in the Spokane, Washington area, you can always reach out to me at enildaclinic.com. I hope you enjoyed the learning video for today, and I will see you next time.